Coming up, we'll be on location at Endres Dental Care in Burtonsville, Maryland, discussing the latest advances in orthodontics and how they can help straighten your teeth and get you that beautiful smile you've always desired with two of this region's top orthodontists, Dr. Stephen Tigani and Dr. Elise Tigani Endres. Welcome, Dr. Tigani. Welcome, Dr. Tigani, as well. It's great to have you both on the Top Doctors Interviews program today.
Thank you very much.
All right. There's been so many advances in orthodontics over the years that really help patients get a better experience and better outcome and results. Can you please share what some of those advances are and how they work?
Well, you're absolutely right. There have been many over the years. And one that has occurred recently is the advancement in 3D scanning. 3D scanning has been around for over 15 years. But recently, in the last several years, it has gotten to a point where it really has become user-friendly for a patient. No longer do you have to take impressions, that lovely goop or plater that goes in your mouth. That's a thing of the past, and they're extremely accurate. And it usually only takes several minutes for this scanner to work, and it gives a clear and accurate picture of a patient's mouth, and we use that to go ahead and to parlay that into making aligners for someone.
I can definitely relate with the goopy stuff and the gagging effect that I used to have, and so did my daughter. I mean, we experienced that. Wasn't fun at all. So the 3D scanning and no more goop is a huge benefit, definitely.
100% agree, yes. And again, very user-friendly, and patients can see the image of their teeth, so it's a fantastic tool to use for a patient to be able to see a misalignment or a malocclusion of their smile line, and something that we love to correct.
Another advancement that's been up and coming as we've gone through the years is 3D printing. 3D printing is something that we're starting to use now to not only take those scans that Dr. Tigani was referring to, but actually allows us to fabricate our own Tigani aligners, which we've been doing for the last several years. And in doing this in-house, it actually makes the wait time for the patient less. So instead of the patient having to wait several weeks to get the retainers and aligners back from the lab, we make them in the house so that they have to wait just a couple days.
And that's another huge benefit for the patients. So you're reducing the wait time. You're making it where the outcomes are more precise with the 3D imaging. We're able to really educate the patient about the type of alignment or whatever issues they have with their teeth, because they're able to actually see that. And of course, precise outcomes, better results.
Yes,
exactly.
And it gives them another option as well. Besides using a brand name, so for example, Invisalign or 3M Clarity aligners, when you have in-house aligners, your own aligners, it's another option. So someone, if they don't wish to have metal braces or ceramic brackets or braces or an aligner system, they might not need an elaborate system to correct their bite. They can then use our aligners instead, and it's just a quicker way of treatment, a more efficient way to getting that beautiful, healthy smile they want.
And who would you say is a good candidate for the Tigani aligners or the other aligners that you offer here?
Basically, anyone that is a candidate for braces, potentially a candidate with an aligner system. Now, years ago, aligners could not do the things that they claimed they could do, but technology has advanced so well in the last 5 to 8 years that they're virtually equal. You can, with the exception of a surgical case, virtually any age, any type of malocclusion can be treated with an aligner system. So whether it is with a major brand, and you choose what brand you wish to have, it really comes down to patient compliance.
And are there any age restrictions for the aligner system?
No, there really isn't. There are some companies that go ahead and say to go ahead and treat a child. I do not. So for me, you start at teenage years. So anybody who is a teenager or older, I'll go ahead and give that option to the patient and or their parent or guardian to see which one they wish to choose. And it really comes down to compliance if they wish to actually wear them.
And what are some of the key patient benefits of the aligner system compared to traditional braces?
Sure. So some of the key benefits of wearing aligners would be the aesthetic reasons. Some of the patients don't want to go and use conventional brackets because they're on the fronts of their teeth. So when they go out and they talk and they socialize, it's an aesthetic issue for them. So usually when patients come in the office and seek aligner treatment, the majority of the time the reason behind that is because of aesthetics. So that is definitely one of the key benefits to doing so. But as Dr. Tigani was mentioning earlier, compliance is a huge issue or a huge topic to be discussed with treating somebody with aligners. So unlike braces, where patients will come in every 4 weeks to have us adjust the braces for them, they're given a set of aligners and they're told to switch them out every so often. So ultimately, the difference between the two is the aligners is a little bit more on the patient's end than our end after we give them all the aligners together.
So besides the aesthetic factor, which drives most adults now to go ahead and want a healthy, beautiful smile, they don't have to have traditional braces put on. There's several other factors as well. Braces in regard to aligners are much more user-friendly. So the discomfort is reduced because the amount of movement that occurs is controlled in such a way that they might feel a little discomfort for a day or two. With braces, it might be a little more intense or last a few more days. So it just depends upon which one you wish to choose to be able to get the result you want. Ultimately, the result will still be the same.
It's also convenient for patients as well. So if they're traveling and they would miss that 4-week appointment that maybe one of them would have with braces, we can give them a couple more aligners so that they don't need to come in once a month. They can go for 2 months with a set of aligners and kind of see us as necessary over those 8 weeks. So if somebody's traveling or they do work business trips and things like that, it does make it a little bit more convenient for those patients.
Absolutely. We have many patients in our office that live or travel all over the world. Right now we're treating some individuals in Tokyo, Japan, in London, England, in Madrid, Spain, and about a dozen in California. With the aligner systems, they are not seen on a monthly basis, but rather on a 3 or 4 month basis. And if they run out of aligners, we ship or mail them more. And with virtual orthodontics, nowadays they can go ahead and send a photograph or a video, and we can go ahead and continue their treatment that way.
That's very impressive. I mean, it's really taken everything to the next level in orthodontics.
Absolutely.
And Dr. Tigani, how long do the typical treatment plans last for the aligner system?
Sure. So treatment plans usually last based on the malocclusion of the patient. What that means is how complex the case is. So depending on whether it's a mild crowding case or it's a case that maybe we would typically offer conventional brackets for, but patient for aesthetic reasons would prefer aligners, that case may take a lot longer than just a minor crowding relapse case.
Nowadays, with the advances in aligner systems and braces themselves, bracket systems, most cases are done within 12 or 15 months. More extensive, more complex cases might take up to 3 years, or surgical cases might take even longer. Right? But the average person now is usually about 12 to 15 months. Someone who has a mild problem is usually 6 months or less.
And as far as braces go, more of the traditional braces, tell us about how they've evolved over the years.
Over the last decade or so, they've gotten smaller, so they're less noticeable. The bracket systems, someone who's older might remember clear braces, and they say they would stain. That's because years ago they were made of plastic. Now they're made of ceramic hybrids. So the clear braces themselves actually don't stain. So if someone does not wish to have aligners or use an aligner system, clear braces is a fantastic alternative for them. But by far the technology and the wires themselves, also the way we move teeth, is extremely efficient now. That reduces time in braces.
They've come out with some lingual systems. What that means is that the braces are actually placed behind your teeth instead of in the front of your teeth. Patients appreciate this option as well because of aesthetic reasons. So if they don't maybe feel comfortable having the responsibility of changing their aligners out all the time, and they want to opt for a more conventional braces option, but they don't want them on the front of their teeth, offering them lingual braces is something we can do as well.
Yes, and those systems as well have become more compact. Years ago they were very large and bulky, so it would irritate your tongue. Now the systems are very small, so it's a less irritation, and again, better mechanical systems, or better mechanics to be able to move those teeth. There's actually advancements in those systems as well, where instead of a traditional lingual braces, there's a specific type out there that allows each tooth to move individually as opposed to an entire unit, all the teeth relying on one another. This system allows each tooth to move and eventually get where it's supposed to be. That's another option for the patient to have.
So there's so many new options, there's so many benefits from these options for the patients, a better experience, better outcomes, less discomfort, more convenient. It's really come a long way over the years.
Absolutely.
Yes, it has. And we truly believe that we want to be able to treat everyone who wants treatment and to give them a healthy, beautiful smile that will last their lifetime.
And Dr. Tigani, what kind of results have your patients been seeing from these treatment options?
So wonderful question. They're actually getting fantastic results with the advancements in technology. So we can virtually treat anyone, again, any age. There's no restrictions. The oldest patients that we've treated are in their 90s, 92 and a 95-year-old. They wanted their teeth to be straight with their grandchildren and great-grandchildren sitting on their lap. The only limiting factor is that your gums have to be healthy, right, and not have active periodontal disease. But again, when we look at someone, we want to treat them to give them the best possible smile they can have that will last a lifetime.
And with these advancements in technology as well, the results that we're getting are fantastic because they're also more precise. So with the technology being more precise, now the results are also more precise as well.
You've established a reputation for excellence in orthodontics. You're really taking care of the patients, providing great results. Can you please tell us about your vision for orthodontics and your practice?
At the end of the day, it comes down to treating someone as you want to be treated as a family member. So as though they're my brother, my sister, my child, so my aunt or uncle, and to give them the opportunity to go ahead and create that wonderful smile for each person. So the vision really comes down to, at the end of the day, to treat someone with courtesy, honesty, and respect that anyone deserves, anytime, anywhere, and to give them that wonderful smile as though they're part of our family.
Well, you've done that for many years in this community. You've helped so many patients get that beautiful smile. And on that note, I want to thank you both for joining us and being a guest today on the Top Doctors Interviews.
Thank you so much.
Thank you so much. It's wonderful being here.